This is take two. Take two, girls.
Ready when you are.
Yes, I'm ready.
3, 2, 1, go.
Checking for safety, making sure it is safe for me to enter the room. I will provide privacy by closing the doors and the windows, making sure that they are not locked for emergency purposes, drawing the curtains for privacy purposes. Since my hands are visibly clean, I will perform hand hygiene using WHO guidelines, and this sanitizer, which is dry intact no precipitates, expires on January 2024, pumping ample amount into my hand, to palm to palm. Palm at the back of my hands. Palms with fingers interlaced. Fingers interlocked. Rotational rubbing of the thumb. Rotational rubbing of the fingertips against palm. Rotational rubbing of the wrist. I'll allow my hands to dry for 30 seconds, and now my hands are dry. I'm happy to approach the patient. Hi, my name is Benz, and I am your nurse for today. I am here to perform some observations and also ask you some questions related to creating a care plan for you. Would that be alright?
Yes.
Thank you. And before I start, I would like to make sure that I am with the correct patient. Can you please let me know your full name and date of birth as I counter check it with my documents, as well as your ID band?
I'm Josefina Hernandez. I was born on the 2nd of 4th, 1949.
Thank you. I got Josefina Hernandez, February 4, 1949. Hospital number is 123456. I'm happy to confirm that I am with the right patient. How would you like me to address you?
Just call me Josie.
Yes, Josie. And how do you feel right now? Do you have any pain?
Yeah, I really feel pain in my abdomen, in my stomach area.
Oh, I'm so sorry to hear that. But can you please let me know if you will rate it 0 as no pain and 10 as the highest pain score? How would you rate it?
I say it's 7 out of 10. It's unbearable for me.
Oh, don't you worry. I will make sure that we'll check your prescription chart for your available pain medications. But I would just like to ask more questions. Does it radiate to some part of your abdomen?
Yeah, it radiates to my back.
Okay, I will take note of that. And also, do you know how long it lasts?
At least every 30 seconds.
Oh my god, I know that must be very difficult on your end, but don't you worry, I will definitely check our prescription chart for any available pain medication for you. And also, I see here that, oh, by the way, I would like to ask, do you have any allergies to food, medication, or latex?
Yes, I do.
And what allergies do you have to?
I'm allergic to penicillin.
What happens when you take penicillin?
It's making me hard to breathe.
So
Rashes as well.
I'm sorry, but that is noted. I also see here that you have red ID band, and also in here, my documentation, it has been documented that you got this kind of allergy, and within my shift, you will not be receiving any medication containing penicillin, okay? And also, I see here that you got the food here and also a glass of water. Are these yours?
Yeah, I'm a bit hungry right now.
Oh, I'm sorry, but would it be fine if I'll just check for your diet status if you are nil by mouth, because I'm afraid that you're about to go to surgery. So,
Oh yeah, I forgot. I'm so sorry. Please do.
sure, I will take your diet status, but for now, please, I will just keep it away and return immediately once I know your diet status, okay? Do you still hear me? I mean, I see here that you have eyelashes here and hearing aid. Do you see me and hear me clearly?
Yes, I do. I just
Okay.
read it. Use it for whenever I'm reading.
Okay, perfect. So, like what I mentioned, I'll be checking for your observations right now. So, I will just let you know that before I start, I'll make sure you'll 5 things that every body part that I will be touching would be free from any infection, inflammation, no recent surgeries, no discharges, basically safe for me to use. And also, the equipment that I will be using were already cleaned and calibrated for the past 24 hours and in service date. And also, every time that I'm gonna touch you, I'll make sure that I will ask for your consent, and also I will perform hand hygiene in between observations. I wanna let you know that your legs should be uncrossed, you've been rested for the past 30 minutes, and also your bladders have been emptied. Is that right? Okay, so to start with, I'll be checking for your blood pressure on your preferred arm. So I'll put an appropriate cuff, BP cuff into your arm. I'll put it 2 to 3 centimeters above the antecubital fossa. And also, I will make sure that it is in line with your brachial artery. I'll pop a pillow underneath so that it is in line with your heart. You will feel a tight squeeze, but that should be normal. And on the other hand, I will be checking for your capillary refill. So I'll check for your nail beds for any presence of cyanosis, for any nail varnish or nail polish. And if there's none, I'm happy to press your nail bed for 5 seconds, and it should the blood should go back around less than 2 seconds. After that, I will be checking. I will be putting in the saturation probe, and it should check for your oxygen saturation. Okay. Now after that, I will be asking for your I will be asking for your um I will be asking for your 2 minutes uninterrupted time. And also, for the first full minute, I will count for your pulse rate, for your rate, rhythm, and also quality of your pulse. And for the next full minute, I'll not be telling the patient that I am assessing the rate, the rhythm, the depth, and the use of accessory muscles for us not to alter the results, but I will tell them later on. So after that, I will be checking for your tympanic thermometer. I will be using this tympanic thermometer, and I will put a pillow underneath. Oh, so sorry. The disposable probe, the tympanic thermometer has a disposable probe on it. I will put it inside the patient's ears, and I will pull the pinna up and back, and you should feel a beeping sound, but that should be normal. So I will do it on the other ear, and I will record which one is higher, and that should be the one to be recorded. And I see here that you've been very I think you're uncomfortable right now. So
Yes, I do. I'm scared actually. I don't know what to do.
I'm so sorry. Is this about your upcoming surgery?
Yeah, I'm afraid.
What's your concerns about the surgery?
I don't know what they're going to do with me. I haven't seen the doctor yet, and there's no one explain what will happen when I come there and go to the operating room.
That must be very frustrating on your end, but don't you worry. I'll coordinate with our physician and make sure to talk to you prior to your surgery and get your consent about it, okay?
Thank you very
I'll
much.
assure you of that. And also, I will just be documenting for the results of our observation. Would that be alright?
Yes, please.
Thank you. Ibigay galing umarte oh.
Sorry. Galing ah.
Hindi na ako mag-art nurse.
Thank you so much for waiting. I appreciate your patience. So I already have documented the results of our observation, and I got here that for your respiration it is 21. Everything is actually normal, but I will still discuss it one by one, okay? So I got your respiratory rate, which is 21, and that's actually a bit higher because of what you're feeling right now. You've been feeling you're having pains on your abdomen. It makes you breathe more than the normal, okay? So but still your oxygen saturation is normal. Your blood pressure is actually a bit high, 149 over 72, but that must be because of your pain right now. And your pulse rate is also very high. It's actually 98, but don't you worry, we will make sure that we will be assessing you every 4 to 6 hours, okay? Now, I also see here that your temperature is 37.2. That should be normal. And I will be relaying these results to my nurse in charge and make sure that you are being monitored properly. And do you have any concerns right now?
Yes, I do. I have left my work without me informing my co-staff as well as my manager. It's just really too sudden, and I really don't know what to do.
Okay, don't you worry. I understand your situation. What I will do is I will make sure to coordinate with our social services, so our social workers, so that they can coordinate with your employer and let them know that you are in the hospital so that they can also issue you a medical certificate. Would that be fine?
Thank you. You're so lovely.
Oh, thank you so much. And I also appreciate your cooperation today, and I appreciate your time answering my questions. Don't you worry. I'll give this call bell to you, and I'll just press it whenever you need any assistance from us. And also assessor, I will make sure that I will clean everything and put everything back in place. I will dispose everything in the clinical waste bin and also make sure that I am performing my final hand hygiene.
Galing.
Compassionate na compassion.